A very good morning to all of you. And it's really a pleasure and a pleasant surprise to see so many orthopedic surgeons in attendance.
Excuse me, you can take off your mask for some time if you wish.
Okay. I'd love to. So I'm surprised and happy to see the numbers of orthopedic surgeons waiting to listen to a rheumatologist or a physician. Anyway, I would like to thank Dr. Agashe and Balki for this opportunity. And we straight away go to the talk. So, post-viral arthritis. Now, viruses really are of great interest to rheumatologists. These are, indolent. Some of them are very indolent. They stay in the body and serve as a sort of stimulus to the immune system, which can lead to autoimmunity. So this is something, we consider viruses as a trigger for several autoimmune diseases. And one of the mechanisms is that the viral particle mimics some of the human cells or some antigens, proteins in the humans. And the human body mistakes the virus for self, leading to autoimmunity. So this is not a comprehensive, but a list of common viruses which can cause joint pains. Apart from joint pains, a lot of autoimmune diseases we consider can be triggered by viruses. Okay? So measles, mumps and rubella, parvovirus, chickenpox, the hepatitis viruses, and the most important or the most common cause of arthritis, chikungunya and dengue, which causes more of joint pains. So we'll move to these one by one. Now, parvovirus, most of us not very aware of it, but it's common in children. And when an adult comes in contact with a child, he may develop an arthritis which mimics rheumatoid arthritis. Okay? There's a test to confirm the presence of parvovirus. Hepatitis B and C have been common bugbears for us, particularly in the when the testing for hepatitis C particularly wasn't being done, we would see a lot of hepatitis C related arthritis, and we have about 8 to 10 documented such cases. Obviously, drug abusers, homosexuals, these are the candidates for hepatitis B and C, in addition to unchecked blood. And hepatitis B in the prodrome can have an arthritis which simulates rheumatoid arthritis. Similarly, with hepatitis C, you can get different types of arthritis, but what is most common is large joint oligoarticular non-erosive arthritis. HIV can cause several manifestations like severe joint pains, spondyloarthritis, severe psoriasis with arthritis, and the treatment of HIV can also be associated with arthralgia related to deficiency of minerals like phosphorus because of renal tubular acidosis. Now, this is, I think, the most important part of the talk, which most of you deal with. And when in 2006, we had the first epidemic of chikungunya, it was something new. We were taken aback by the suddenness of, the onset. So the patient has fever for a day or two, immediately followed by severe joint pains, which involve the joints of the hands and feet, and sometimes the knees and ankles as well. It's the suddenness which is a sort of signal that this may be a post-viral arthritis. Okay? Another symptom that we ask for is the presence of a rash. This happens in about 20% of patients, but the presence of a rash sort of is a confirmation, is a clinical sort of confirmation that perhaps this is related to chikungunya. Also, we have a history in other members of the family in the neighborhood, and patients will say yes about my neighbors also had similar complaints, and that makes us think of post-viral arthritis. So this arthritis chiefly affects the small joints of the hands and feet, and there's a lot of tenosynovitis causing diffuse swelling of the hands and feet. Also, the knees and ankles are affected. Sometimes it's excruciatingly severe, needing use of steroids. The arthritis usually lasts about 4 to 6 months, and it has a downward trend. So that also is an indicator of a post-viral arthritis. So if the patient comes to you down the line 3 months and says that he's much better than what he was before, it's an indication that this is probably a post-viral arthritis. And just a little warning that chronic arthritis can occur in about 5% of patients in different studies following dengue. So these may be genetically predisposed individuals, okay? But it can happen. This is an Indian series which reported a 5% incidence. And lastly, dengue, which is not really causing arthritis, but severe body and joint pains. And we as physicians, clinicians, and orthopedic surgeons need to be aware that fever with severe body pain, one also needs to consider the possibility of dengue. Of course, associated findings like low WBC platelet count helps us in the differential diagnosis. And I think no conference in today's world can do without the C word, and that's at the end of my talk. COVID-19 as a cause of arthritis or arthralgias. Now, what is so distinctive about COVID-19? So COVID-19, when it affects the lung damage is caused by certain cytokines. One of them is interleukin-6, which is also raised in patients who develop flares of rheumatoid arthritis. So it seemed quite likely that patients who have COVID-19 might develop a flare of their existing rheumatoid arthritis or might develop a new onset of arthritis, what we call a reactive arthritis. And although there is no clear white paper on COVID-19 and arthritis, there are several case reports which have talked about arthritis post-COVID, and even post-vaccinal, we come across every now and then in the clinic the onset of arthritis or a flare of arthritis following COVID. Now, as clinicians, what should we do when we are faced with viral arthritis? Now, as I mentioned, the earlier ones, the post-exanthematous arthritis, usually are self-limiting. So only non-steroidal anti-inflammatory agents would suffice. However, chikungunya and even COVID-19 related arthritis can be quite severe sometimes and calls for treatment because one wouldn't want to use NSAIDs forever. So here we use disease-modifying drugs like we use in rheumatoid arthritis, but we tell the patient that this is going to be for a finite period, and usually it's about 6 months, sometimes up to a year. In hepatitis C or some viruses where treatment is available, for example, HIV, hepatitis C, antiviral treatment is also added on so that the antigenic stimulus for the arthritis is no longer present. So I end my talk, and this is a new beginning with an in-person conference, and 3 cheers to that. Thank you.